Cambodia is one of the least developed countries in Southeast Asia. Many Cambodians are still living on an income of less than $2 a day. But their spending on public services, and specifically healthcare, is still very high, especially if we focus on the price of medicine, which is provided by national health institutions and the private sector. Good healthcare information is also very limited for people who live in isolated areas and frequently go to Kru Khmer or traditional healers rather than going to the doctor for medical treatment. Many patients with chronic diseases or non-communicable diseases, also known as NCDs, are seeking long-term medical treatment and face very high costs, which have pushed them to deeper poverty. In recent years, the World Health Organization, the WHO, has begun to pay attention to the high burden of NCDs and the importance of interventions to curb this epidemic, which has now been recognized by the Cambodian government and for the first time was recognized as a key program in its 2008-15 National Health Strategic Plan. But before that, in 2006, MoPoTsyo had already taken action by setting up its Revolving Drug Fund to help their members with diabetes get access to routine medication in poor areas around Phnom Penh.
Systems like in Cambodia have specific problems for providing care to patients with chronic conditions that have to come back to the health center or to the hospital on a regular basis to get their medicines. And the idea of the Revolving Drug Fund that is in place, for example, in Cambodia in the MoPoTsyo project, is to try and address the problems of these chronic diseases, patients with chronic diseases, for example, with diabetes and hypertension, because the current way that the health center in Cambodia functions does not allow them very well to take care of the patients with diabetes and hypertension, and the medicines that are available there are not available on a regular basis for these patients. They can, for example, only give medicines for a few days, while the patients with diabetes or hypertension need those medicines every day and for their whole life.
Moritz van Pelt, director of MoPoTsyo, has also taken on this challenge in rural areas where many diabetes and hypertension patients are found and have a very hard time paying for the high cost of medicine if they can even find the right medicine at all.
This is a revolving drug fund which is for members and it is for chronic disease. So there are some other revolving drug funds, but they are for anybody who shows up and who needs to buy medicine with their prescription. But in MoPoTsyo it's membership based. And we have it made a closed system. It is like you create a club of people with the same needs. And if you are a member of the club, in principle, if you have the disease, you can register yourself, but then we need to know who your ID and we need to know where you live, and there will be a peer educator who is helping you how to live with your disease. So it is a fixed system which is able then to grow over time if more and more people join, and if more and more people have access to a prescription from a doctor who prescribes in their patient book which are the medicines that they have to take.
The Peer Educator Network has played a very important role in this process. Every peer educator has received a 6-week training by MoPoTsyo about NCDs, how to screen for new NCD patients, and how to introduce them to a new lifestyle. They follow up patients who register as MoPoTsyo members.
ប្រកបថាបើស្អែកបូមឈាមល្ងាចនឹងឬក៏ពី3ថ្ងៃមុនកុំហូបអ្វីរបស់ដែលខ្លាញ់ឬក៏បាយសអីច្រើនពេកហូបបាយតម្រូបអីចឹងណា
ចឹងជំងឺដែលត្រូវដែលអ្នកជំងឺត្រូវធ្វើគឺជាខ្ញុំផ្ដល់ព័ត៌មានប្រាប់តែបើសិនជាមិនតាមអានឹងជារឿងរបស់អ៊ំពូមីងបងខ្ញុំអត់ដឹង
The peer educators give information to the patients, but also collect and transfer all the information from patients to the database, and this becomes available for the doctor, MoPoTsyo staff, and pharmacists and supervisors. Mialina is a peer educator who lives in a very poor area of Phnom Penh. The patient community recognises her as an important person to help and represent them as a group.
ពីមុនមកគាត់គិតថាជំងឺទឹកនោមផ្អែមនេះគឺជាជំងឺមួយដែលមើលជាតែពួកខ្ញុំប្រាប់ថាជំងឺទឹកនោមផ្អែមព្យាបាលមិនជាទេព្រោះអីគ្មានអ្នកណាមួយច្បាស់លាស់ថាជំងឺទឹកនោមផ្អែមហ្នឹងព្យាបាលជាទេគ្រូពេទ្យណានៅណាក៏គ្មានថាច្បាស់លាស់ខ្លះកើតជំងឺទឹកនោមផ្អែម
She also played an important part in the enlargement of this project through her enthusiasm and her experience. First as a diabetes patient since 2006 and later as peer educator.
សម្រាប់ខ្ញុំមានការពិបាកណាស់ការណែនាំប្រជាជនឲ្យផ្លាស់ប្ដូរផ្នែកគំនិតអំពីជំងឺទឹកនោមផ្អែមគាត់ថាជំងឺទឹកនោមផ្អែមព្យាបាលជាតែចំពោះខ្ញុំដឹងថាជំងឺទឹកនោមផ្អែមព្យាបាលមិនជាទេហើយមានអ្នកជំងឺមួយចំនួនគាត់ចង់ជាគាត់ចំណាយលុយច្រើនលើថ្នាំហើយជាការងាររបស់ខ្ញុំក្នុងការផ្ដល់ព័ត៌មានដែលត្រឹមត្រូវជូនពួកគាត់
So many patients needed more information about self-management. And so we began to train patients, especially the ones who are literate and who can then become peer educator for other patients in their area. And later on, we also began to help the patients to organize the services that they need because those services were not there. Sometimes the services exist, but people have to travel very far. So then the distance is a problem. And sometimes it's the quality of the service is a problem. If there is the attitude of the staff, people are not friendly or there are other barriers.
តម្លៃខ្ពស់នៅខាងក្រៅសម្រាប់ថ្នាំអ្នកជំងឺទឹកនោមផ្អែមនិងអ្នកជំងឺលើសឈាមដែលថាជំងឺមិនឆ្លងរ៉ាំរ៉ៃមិនឆ្លងហ្នឹងធ្វើឲ្យផលប៉ះពាល់របស់គាត់ដូចជាធ្វើឲ្យគាត់លេបខានក្រោយមកធ្វើឲ្យមានផលប៉ះពាល់ដូចជាទៅលើភ្នែកទៅលើបេះដូងទៅលើតម្រងនោមត្បៅមើលមិនជាលើជើងជាពិសេសបាទក្រោយមកអានឹងឲ្យជាផលប៉ះពាល់ធំពេលហ្នឹងហើយគាត់អាចអស់លុយច្រើនជាងអ្វីដែលគាត់ទៅទិញថ្នាំនឹងទៀត
កាលមិនតាន់បានជួបនឹងអង្គការចេះតែដើរទិញថ្នាំក្រៅអូនណាក្នុងមួយខែអស់ 4-5 ម៉ឺនហើយដល់បានមកជួបអង្គការទៅបានក្នុងការចំណាយគឺបានធូរច្រើនក្នុងមួយខែអស់តែ 7,500 នៅវាខុសគ្នាច្រើនណាអូន
Beginning from rural areas around Phnom Penh, MoPoTsyo first bought its medicine at intermediary wholesalers in the capital, but later began to buy it from the international markets and to import and register the medicines. Over time, MoPoTsyo enlarged its capacity to keep its supplies at 21 contracted pharmacies, most of them in the provinces. All of them regularly receive enough stock so that they can sell prescribed medicines at fixed prices to the registered diabetes and hypertension members.
We have put the medicines at the local pharmacy and we have put the medicine there which we know that the people need, and then we've made a deal with the pharmacy that they would sell it at a fixed price, and that was respected by the local pharmacy. So over time that has been expanded, and then when the membership was big enough, we have moved to buy these medicines on the international market, and we have begun to import them.
One of those pharmacies is in MoPoTsyo province. It's the first time for a public referral hospital like Barai Santuk to adopt a whole system for people with chronic diseases who live in the geographical area covered by the hospital. In 18 out of 19 health centres, there's now a diabetic peer educator trained in screening and disease self-management. The system was set up in 2012 under the partnership of MoPoTsyo and Revolving au Développement, or Louvain LD, a Belgian NGO linked to the Catholic University of Louvain.
ពីដើមយើងមានឃ្លាំងឱសថសម្រាប់មន្ទីរពេទ្យទាំងមូលបាទហើយយើងមានការផ្គត់ផ្គង់ថ្នាំផ្សេងក្រៅពីទំនោរផ្អែមលើឈាមហ្នឹងយើងមានថ្នាំលើឈាមទំនោរផ្អែមពីក្រសួងសុខាភិបាលដែរប៉ុន្តែមាននៅក្នុងកម្រិតមួយដែរអត់ទាន់សមស្របជាមួយនឹងប្រជាជនយើងបាទអញ្ចឹងនៅពេលដែលមានអង្គការMoPoTsyoនេះគាត់មកគាត់ជួយរឿងថ្នាំសង្កូវនឹងបានគ្រប់គ្រាន់អញ្ចឹងហើយយើងដាក់ថ្នាំនឹងនៅក្នុងឃ្លាំងឱសថមន្ទីរពេទ្យយើងជាមួយនឹងយើងមានមនុស្សសម្រាប់មើលការខុសត្រូវខាងឱសថនឹងផ្ទាល់បាទខែរក្សាហើយចែកចាយហ្នឹងគឺយើងយកបុគ្គលិកដែលធ្វើការនៅក្នុងឃ្លាំងឱសថនឹងតែម្ដងដោយសារគាត់មានបទពិសោធន៍ច្រើនអញ្ចឹងងាយស្រួលក្នុងការគ្រប់គ្រងងាយស្រួលក្នុងការបញ្យល់ពីការប្រើប្រាស់
ងាយកន្លះគ្រាប់ចាលេខព្រឹកងាយចាហ្នឹងព្រឹកកន្លះងាយកន្លះក៏ប៉ុន្តែមិនមែនខ្វេះលេខគ្រប់កញ្ចប់ទេណាគឺលេខអស់មួយទៅវាមានតែពីមុខទេឆ្នាំហ្នឹងហើយតាំងពីខ្ញុំចាប់ធ្វើការនៅកន្លែងឃ្លាំងឱសថហ្នឹងមកជាង30ឆ្នាំហើយពីមុនយើងធ្វើការគឺមានអ្នកជំងឺចំនួនតិចតួចតែដល់ចូលបច្ចុប្បន្ននេះជំងឺវាច្រើនជំងឺច្រើនការងារយើងក៏មានច្រើនដែរហើយការវិវត្តរបស់យើងក៏វាជឿនលឿនទៅមុខជាងកាលពី30ឆ្នាំមុនអញ្ចឹងរបស់យើងប្រើគឺវាទំនើបជាងមុនទាំងអស់ឥឡូវនេះ
Over time, MoPoTsyo had to face two major problems that had to be solved. In the early years, some contracted private pharmacies didn't pay the bills of supplies from MoPoTsyo. Overall, the pharmacies were receiving more and more from MoPoTsyo's Revolving Drug Fund central stock in Phnom Penh to meet the demands from the patients, and they were indeed selling more to MoPoTsyo members who were paying cash. As the number of members keeps growing every year, the first column and third columns are growing equally fast, but the middle isn't growing as fast, showing that some of those pharmacies didn't respect their contracts with the NGO. To solve the problem, in 2011, MoPoTsyo renegotiated the contracts and began to charge interest over bills that were outstanding for more than 100 days. In 2013, MoPoTsyo began to enforce these new contracts so that the problem was reduced. Now let's take a closer look.
After this initial capital investment and purchase of a stock inventory for the warehouse, they are given to contracted pharmacies or pharmacies that MoPoTsyo has an agreement with on credit. So the pharmacies actually do not pay MoPoTsyo for the medications initially, the very first time they're given these medicines on credit.
In the beginning we did not have formal arrangement with the pharmacy, just try it out, how it works, and then later you make a first contract. And then you see that the pharmacy, they promise that they will give you the information, but they did not record everything. Some of your medicines is sold to non-members. So you have to gradually perfect the administration of your system.
Collecting data was a very hard task for MoPoTsyo, as many Cambodian patients never ask for a receipt or invoice when they buy medicine. To create an incentive, the peer educator gets 12 cents if he can collect the original invoice from the patient. Because the peer educator is now urging the patient begins to ask the pharmacy to fill out the invoice for what the patient has bought. This created some pressure on the pharmacies. To help facilitate the important administrative process, the German International Development Cooperation Agency, GIZ, gave financial support to MoPoTsyo for the automation of the invoicing system and the purchase of the hardware, such as computers and barcode readers.
ពីមុនគេឲ្យយើងទៅសេជាវិក័យប័ត្រចឹងណាតែដល់ឥឡូវហ្នឹងគេឲ្យយើងចូលជាប្រព័ន្ធក្នុងកុំព្យូទ័រគឺងាយស្រួលលឿនខ្ញុំចូលចិត្តការងារនេះ ពីព្រោះវាល្អហើយធ្វើបានសម្រាប់ទៅអ្នកជំងឺវាមានតម្លៃថោកងាយស្រួលអ្នកជំងឺកុំឲ្យគាត់ល្អូថាអង្គុយចាំយូរអីអញ្ចឹងយើងត្រូវការទាន់ចិត្តឲ្យគាត់
I think what is really important is to consider that with the revolving drug fund, the point is that the patient has to pay for their medicines. When you're talking about the poor patient earlier, the revolving drug fund per se does not provide a solution for the very poor patient because they still have to pay for their medicines. Of course, what the revolving drug fund does is that compared to the private pharmacy, where the medicines are much more expensive, what the revolving drug fund does is that it helps bring the medicines, for example, in some private pharmacies, at a reasonable price compared to the prices where they were sold before, which were sometimes 6 times the international price. The revolving drug fund brings this price down. This is the most important aspect.